Good morning to all of our viewers and followers, and welcome to another episode of Swoot Morning. I'm Jennifer Sarah, and as always, we have interesting topics to discuss together. The heart is a very important organ and element of our body, and without this muscle beating, we can literally not live. Surgeries on the heart have always been very specific and extremely important. But the stereotype remains that people with heart diseases or people who have undergone heart surgery cannot go back to their work and don't have much time left on their clock. Today we have Dr. Rafik Abu Samra, a senior consultant and the head of heart surgery in Al Zahra Hospital, Sharjah, to talk to us about robotic assisted surgeries and that nowadays many people can go back to a normal life and to their work just a few days after those minimal invasive surgeries. Welcome and good morning.
Yes, welcome.
Thank you so much for joining us.
Thank you.
Can you first explain the functions of the heart and why it is so important?
Of course, the heart is an organ that pumps blood throughout the body and via circulatory system. This is the mainly function, pump the blood around the body. This is the function of the heart. And you ask about why it's important.
Yes.
Yeah, because it's the blood carrying oxygen and nitrogens and removing other wastes.
Okay.
Without this, we can't live.
Yeah.
Yeah, this is the more important thing for the function and the why is important.
And can you say what heart diseases are the most common ones and how they can be treated?
Yeah, of course. Mainly 80% of procedures done in cardiac surgery in general around the world, it's coronary heart disease. The name of the procedure is bypass in English. So other 20% is mainly valves, mitral valve and aortic valve, and other some defects in the septum between the atrium and the atrium, or defect between the ventricle and the ventricle, but mainly is coronary heart disease. And sometimes we have complications after infarctions like VSD or something like that, but it is rare cases. Mainly 80% is coronary heart disease.
And can you show us on the demo what that means?
Yeah.
Like what isn't functioning?
And our muscles, our heart muscles, is supplied blood by two mainly arteries, right side and left main. Left main we have LAD and CX, and right side we have just one artery. And around our heart pump around 5 liters per minute.
Per minute?
Per minute, yeah,
Okay.
of course. And part of this blood is going to our coronary artery, supplying our heart muscles blood.
Okay.
Which carrying oxygen and nitrogen.
And can you tell us something about the minimal invasive surgeries, what that looks like, and what is different to what you used to do?
Yeah, mainly 95% procedures around the world done classic surgery. What it means classic surgery? It means that we will do sternotomy, we'll open the chest. Minimal invasive is two types of minimal invasive. First, that we will not open the chest.
Okay.
We will harvest the mammary artery. This is artery to supply muscles for our chest, and make anastomosis this artery to our mainly LAD. And in this type of procedure, we open also 3 centimeters, but we know sternotomy.
Okay.
And the more advanced is using Da Vinci system. Da Vinci system, when we don't open 3 centimeters, just we have 3-4 holes around 1 centimeter or less, and we can harvest the mammary artery, as well as we can do anastomosis using instruments, control from outside. We don't open anything.
And why is it called Da Vinci?
The system is produced in USA by an entitative company, named the company, and the name of the system is Da Vinci.
Okay,
I
so
think,
it's not,
regarding
it's not
the,
an idea that Da Vinci
no,
had.
it's not from Da Vinci, but it's the name, just the name of the system Da Vinci.
Okay. And what can you say about robotic assisted surgeries? What does that mean? Is that a robot doing the surgery?
No, many people think that the robot is the shape of the robot like a surgeon, and he is standing around the patient and he will do the procedure. It's not like this, because the system is just column and 4 arms, and these arms, every arm has his function, and all of these arms controlled by the surgeon who is sitting around 5 or 4 meters far away from the patient. And you have joysticks, screen, enlargement around 10 times, and 3D. You see everything 3D, and you are concentrate for the on the screen. You see everything which is inside the patient. Okay. When you move your fingers, the instrument there is moving the same movement.
It sounds a bit like one of these superhero films, you know?
Yes, it's like joysticks when we was young and we play. Yeah. And the problem that this is very, 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 you should be very, very careful, because 1 millimeter, if you move your fingers, your hand in the instrument, and that it will be 5 centimeters. So you should coordinate your fingers with your eyes, with your mind.
And what is the advantage of that robotic assistance?
Advantage that first, no sternotomy. You don't open the chest. For many patients, it's very important because first, cosmetics, scar, no scar. No chest, you don't open the chest. Second, mainly our patients, especially coronary artery disease, they are diabetic people.
Okay.
And the healing of the wound will release. So if you don't have wound, you don't open the chest, for them, it is also good. Second thing, the stay of the patient in classic surgery around the world is between 10 days to 2 weeks. And the period of the recovery after the procedures, when the patient is discharged and he is at home, will take around 2 to 3 months.
Yeah.
But in this case, we can admit the patient Sunday, procedure will be done Monday, Friday patient go home, next Friday he can go back to his normal life and he can work. This is the advantage also. The possibility of infection, it's around 2 to 3 to 4% of the normal classic surgery. Using Da Vinci system or minimally invasive, the infection is minimum, very minimum. Mostly no infection.
So basically you're saying that first of all, the recovery is faster.
Yeah, of course.
The risks are less.
Yes.
And the scars and the pain is less as well.
Yes, as well, of course.
And all minimal invasive surgeries, are they all done with these robotic hands?
Not necessary, because first, system is very expensive.
Okay.
Second, few people around the world can use the system.
Okay.
Not like the difference between minimally invasive and using robot Da Vinci system is that minimally invasive, you will not do sternotomy, you will not open the chest, but always you have 3-4 centimeters open from this side for mitral valve or this side from cavity. But Da Vinci system, you will not open anything.
Okay.
And because of the cost and because of the few people around the world can use Da Vinci system in cardiac surgery procedures, that is not popular. But
Okay.
I think that more and more now around the world, the surgeons start to learn how to do minimal invasive and how to use Da Vinci.
So you need a special training for the
To
learn how to use the joysticks.
Yeah. It's long. You should start with off-pump procedures that if you want to do cabbage, for example, and generally the patient done using a heart-lung machine, stop the heart, and you shall start do it off-pump, mean that you will do the procedures and beating heart is working and you do the procedure. When you will be good in this and you will be able to do these procedures, you start to do using endoscope. You will harvest the mammary artery, for example, by endoscope, and you should do a few hundred procedures. Then you can start training with Da Vinci. So it's step by step. It is not that from classic surgery you are going to Da Vinci system. You shall do it step by step, and many factors around you. You should work in the hospital. You have support from the administration. You should you should have good skills like a surgeon, and you should be the problem sometimes that you have everything, but you don't. These factors, it's around 6, 7, 8. If you lost one of these, you will not do it.
Okay.
So it is not easy, but I hope so that many surgeons around the world start to do it.
Start to learn.
Yeah.
And is there anything that you would recommend, a test or something where you say people should have that done on a regular basis?
Yeah, of course. Recommended after 40 years old to do 1 time per year stress test.
Stress test?
Stress test,
okay.
yes.
What is that?
Yeah, it is you will do exercises and you will see your ECG. Is any changes or no? This is called stress test. 1 time per year should be done after 40 years. And time to time we can do echo, we can see our valves function is good or no. And for all the people, if they feel something for rhythm, our heart rhythm, or any dyspnea, for example, and syncope, anything, immediately go to the cardiologist to check.
Okay.
And this is, I think, the most important thing. Other things, check up 1 time per year for everyone. I think it is recommended.
Okay. Well, thank you so much for being here this morning and for giving us this good advice.
Yes, thank you so much also.
And after the break, we'll be back with some beauty hacks for you.